So I want to introduce our next presenter, Dr. Cait DesRoches. Cait is the Executive Director for OpenNotes, and she is also an Associate Professor of Medicine at Harvard Medical School. And Cait is going to quickly help summarize what we have been learning from more than 170 health systems that have started sharing OpenNotes. Cait, take it away.
Thanks, Liz. Can you hear me? Okay.
Yes.
Yes.
All right. I promise to be quick because I think we're going to have quite a few questions and a lot of discussion from the great presentations that we've had so far. So I'll go very quickly. This first slide is simply just a reminder about the core concepts of patient and family-centered care, and we think that OpenNotes fits very nicely into these core concepts, including collaboration, information sharing, participation, and really treating patients with dignity and respect. Next slide. So here's just a quick reminder. Here's what a patient sees when they get their after visit summary. So that's on the left, and this is Liz has nicely shared this with us. So here's what they see when they get the after visit summary. So they know what their blood pressure is and what their temperature was at the time, and is their BMI still the same? There's some useful information in there, but then on the right we see what the notes say. And so for many patients, and Liz included, I've heard her tell the story several times about what a revelation it was to read the notes and see the richness of the information that's in there. Next slide. But what we're finding is not everyone is getting the benefit of reading their notes, even when they are getting care in an organization that offers notes. And what we're finding from our, so what we decided to do is take a look at, well, why might this be happening? And we were hearing sort of anecdotally patients saying things like, I can't find my notes, no one told me I could see my notes. We had clinicians saying no one told me we were sharing the notes. And we heard a lot of this was a non-event, which led us to think maybe it's a little difficult for patients to find the notes or read the notes. And we wanted to understand how to maximize the benefits and also minimize the risks. What we did was we went back to our implementers and asked them for a set of information. And these pieces of information included qualitative markers like we tell our patients about this, we have a communication plan that we follow, we send patients emails, and then we also asked for some hard data. So what proportion of notes available on the portal are actually opened by patients? We got back information from 26 organizations, primarily EPIC organizations, and I'll talk about why that is in a minute, and 2 homegrown organizations. And you can see that the percent of notes opened really varies. And it's sort of grouped together. We had 4 organizations that were in the 20% plus, and then an additional 8 in the 6 to 10 range, and then the rest were very low, less than 5%, and many of those are in the 1 to 2% range. Now, the reason that these are EPIC, almost all EPIC organizations, is that other EHR vendors cannot calculate this kind of a rate. Next page. So we fed this information back to the vendors, and we gathered more data on why we might be seeing these reading rates. And what we found from Cerner can measure whether patients are viewing and downloading things, but they cannot say specifically this patient opened a note. Same thing with Allscripts, with Meditech. Now, Epic does have this. They also offer this as an option on their dashboard, so organizations can easily generate these note reading rates themselves. And they have a standardized note opening rate that I won't get into the sort of details of that right now. But with the idea that what gets measured gets improved, it was concerning to us that most of the major vendors cannot calculate this kind of read rate. So organizations have no way of knowing if patients are reading their notes or not. Next. So a few other things, these are more qualitative, but what we're understanding around quality implementations is that ease of navigation on the portal seems to be one of the biggest markers for whether patients are reading the notes or not. So the fewer clicks they need, the easier, the less they have to hunt and peck, the more likely they're going to be to read the notes. Communication efforts with patients do seem to help, but it has a modest, from what we're hearing, and we don't, I'll just be upfront about this, we don't have hard outcome data to back this up, but what we're hearing is, yes, we're doing communication, but what really helped us was figuring out the portal navigation issues. Reminders when patients have a note available do seem to be powerful, but the details of how those reminders are done matter. So whether the note says you have something new on the portal versus you have a new note written by your clinician, click here to read it, is going to matter. And linking back to what Anshu was talking about earlier, mobile access seems to be very important. And we know from trends in the greater world of technology that we are moving in that direction, but many places cannot offer mobile access to notes yet for patients. And I think I did it in 5 minutes, which was my allotted time on the agenda. So I'm going to turn it back over to Liz and Carrie for the Q&A.